This second part of the basic health lecture will mainly focus on the terminologies related to public health field and more details according to the public health interventions. Like many professionals, public health professional needs to have unique approach or intervention methods to cope with the unique problem. So language to correctly, precisely communicate among them is required. Almost all of them are English words, not Latin or Greek like in medical terminology. You may find these strange words in the public health reports, publications, or even on the news related to public well-being. For instance, words like life expectancy, health education, health promotion, prevention, endemic, epidemic, pandemic, interventions, mortality, morbidity, stakeholder, policymaker, the risk factors, acute or chronic diseases. From previous lecture, the public health aims the good health of the population. How do we define the health of the population? Words commonly used to define the situation of health of the population, such as life expectancy and under 5 mortality. You may have heard of word lifespan, which is the limit of natural life can live as long as possible. But life expectancy means the statistical measure of the average time of the human is expected to live. The life expectancy is the age-specific death rates of the population members by using a large amount of data available to create life expectancy in specific population. Public health scientists and epidemiologists always feel that both terms are not exactly the same, since life expectancy means to be largely interfere with unnecessary risk and can be controlled by human lifestyle, behavior, and environmental modifications. You may see on this slide that the life expectancy in low-income countries are much shorter than developed countries. The people in Europe and Canada, as well as in Australia, live very much longer than the others. This parameter is mainly affected or modified or controlled by the public health system of each region. The child age younger than 5-year-old mortality means child deaths under the age of 5 years per 1,000 live births is also a very good indicator for population health. When life expectancy is short, this is mostly due to the very high child mortality rate. Mortality of under 5 is declining all over the world, but still higher in underdeveloping countries. More than half of under 5 deaths are due to the disease that are preventable and treatable, for instance, premature birth, pneumonia, septicemia, diarrhea, malaria, and malnutrition. Now, let's have a look. If the people live longer, but with suffering, especially from chronic disease or disability, this is also considered unhealthy. What description used to represent this stage of unhealthy life? We use disability-adjusted life year, which is the measurement of overall disease burden expressed as the accumulative number of years lost due to sickness, disability, and early death. How the public health approached the problem and managed it through the final phase as the implementation of the way to do the problem solving, the way for the problem prevention. So first, we have a look at the good, reliable, and on-time surveillance. The surveillance is the source of the hint of the occurring of the real problems, that we can say that something needs to be done for this situation. Then the risk factor related to the problem has to be identified. Then the way to intervene this problem, such as the specific program, must be reviewed and use them or test them. And finally, evaluate the outcome. And the last step is to implement the program that we have evaluated already into the big scales. This is covered by the previous lecture. Starting with the problem identification. It is a real problem that needs to do something already or not? Using the good systematic surveillance to see the impact of the problem. Good surveillance system is the best tool for problem defining. There are two types of surveillance system as active and passive surveillance. This will demonstrate disease frequency and disease pattern, like incidence, prevalence, case fatality rate, morbidity and mortality rate, as well as how the illness spreads, like epidemic or outbreak or pandemic. After defining the risk or harm, the factor association of risk to the problem, like odds ratio, or the information from data from the surveillance, helping for defining the risk associated to the problem. The interesting video link about the odds ratio is also attached. The passive surveillance has proven to be useful in identifying outbreaks and trends over time. The healthcare providers report notifiable disease on a case-by-case basis. The passive surveillance is advantageous because it occurs continuously and it requires few resources. However, it is impossible to ensure compliance by healthcare providers to report. Moreover, cases occurring in people without access to healthcare will frequently go underreported. Consequently, passive system or passive surveillance tend to underreport disease frequency. The active surveillance occurs when the health department is proactive and contact healthcare providers or laboratories requesting information about disease. While this method is more costly and labor-intensive, it tends to provide a more complete estimate of the disease frequency. The incidence and prevalence. The incidence should not be confused with prevalence. So, incidence is the measure of the probability of occurrence of the given medical condition or the new case in population at risk within a specific period of time. It measures of the disease event and the disease risk. While the prevalence is the proportion of cases in the whole population at the given time, is the measure of the disease burden. The incidence conveyed information about the risk of contracting the disease in the high-risk population, whereas the prevalence indicates how widespread of the disease in the total population. Both incidence and prevalence can be only point data or period data. The first video attached is a very nice video explaining about the incidence and prevalence. Please spend 5 minutes watching it. When you have a look at incidence, it tells only the risk or the event. But the incident rate is another aspect of looking at the emerging of new cases among the high-risk people. This calculates under the time that all the population at risk stay or remaining at risk during the period of data collection. So it can tell more detail of the burden of disease, how quick the disease developed or spread. So let's have a look at the 14-year survey of the subject taking the aspirin to prevent the heart diseases on this slide. The incidence rate of a new case during this period of time was 25%. But have a close look at 7 people who drop out of this data collection, means no longer a high-risk people until the end of the survey, while the 2 has no heart disease throughout the survey. So the accumulate of the total time people at risk stay in survey was counted and presented as the incidence rate at the end was 30 person year during 14 years of observation. Once the evidence exhibits that the problem occurs for real and the risk of the trouble is already identified, the way to tell that the risk was captured is truly related to the problem is called the strength of association. One of the statistic parameters, the odds ratio, used to tell the correlation of the risk exposure to the problem. The odds ratio is a ratio of the people who exposed to the risk who get sickness against the one who not get sickness or not get even. Most commonly used in case control as well as the cohort study. Let's have a look at the odds ratio interpretation of the infant born with passive smoking from maternal smoking during pregnancy on this 2x2 table. The odds ratio is 1.5. Seems that the baby who has exposed to passive smoking has 50% higher chance of childhood asthma, the chronic airway hyperresponsive sickness. If the odds ratio is equal to 1, exposure is not associated. If odds ratio more than 1, positively associated with the disease. But if it is less than 1, the exposure is negatively associated with the disease. The 95% confidence interval, or CI, is used to estimate the precision of odds ratio. The large CI indicates a low level of precision, whereas the small CI indicates the higher precision of the odds ratio. Unlike the p-value, the 95% CI does not report a statistical significance. In practice, the 95% CI is often used as a proxy for the presence of statistical significance if it does not overlap the null value. For example, OR equal to or odds ratio equal to 1. Morbidity and mortality are one of the crude rate terms that the public health uses to describe how the problem is. As I have explained earlier how quick the problem is. The public health people use to evaluate the situation by using the incidence rate, prevalence, how wide the problem spread, such as epidemic, pandemic. But how serious, even with not so wide spreading of the disease, but it's a very, very high death rate or fatal, or living with the consequences of that. So we use the mortality, morbidity, and case fatality. So morbidity refers to unhealthy state of individual, while mortality refers to the state of being mortal. The two are often used together to calculate the prevalence of the disease, for instance, dengue, hemorrhagic fever, or even with a chronic disease like diabetics. We see how likely that the disease is to be deadly or to be long run like a chronic disease in that certain demographic. Case fatality rate used more in terms of acute disease. The case fatality rate, or CFR, is the proportion of the deaths within an identified population of interest. The case fatality rate measures the severity of disease that caused deaths. This slide emphasizes again the meaning of the word endemic, epidemic, pandemic. These terms are often used in the same context, but actually have different meanings to describe the spreading of the problem, especially the infectious diseases. The term endemic refers to disease which is natural to or prevalent within and confined to the particular area. Malaria is a good example of an endemic disease in tropical countries, since it is found only in tropics. An epidemic or outbreak refers to the relatively spread of the disease rapidly to the large number of population or to areas where it is not normally prevalent. The flu epidemic that occurs each winter is one example. In California during spring break, if the couple of cases of malaria are diagnosed, this could be the alarm of the outbreak, since this area is not endemic area of malaria, while HIV, hepatitis, and influenza is considered as the endemic in California. A pandemic refers to the spread of the disease throughout the country, continent, or the whole world. In February of the year, the World Health Organization declared the rapid international spread of Zika virus and its suspected link to the birth defects to be an international public health emergency, for example. So next, come to the intervention and evaluation of the tool or the program in this stage. This stage also involved many stakeholders, and difficulties depends on the character of risk, illness, and policy, and so many other factors. The major obstacle is the word success, means how we define outcome of intervention that we test or evaluate or intervened. So let me give you one example. The proxy outcome, like the improvement of the city pollution after intervention or the program. Will this represent the morbidity and mortality of respiratory system in that group of the population or not? If it is a short-term impact or long-term impact, how you conclude the outcome or the success of that program. So the evaluation of that determinants that we choose to intervene has to be defined clearly before we step forward to say that this program is success under that evaluation before going forward to the implementation levels. So this stage, the word that you may need to know, the meaning is the intervention. The intervention means to come between as to an influencing force. This is by Webster Dictionary. It is a generic term used in public health to describe a program designed to have an impact on the health problem. The intervention is essentially identical to the program or the plan or procedure for dealing with the matter of the health problems. So after that evaluation, we do implementation. In the stage of the implementation, we talk about the success or the outcome of the previous evaluation. But you may remember that I talk about evaluation during the process. It's a process evaluation, the impact evaluation, and the outcome evaluations, including together. But at this stage of implementation, it's not solely on only that evaluation. This scale of implementation may involve the policy making, and it's always deal with the limited resources all over every area. So the primary evaluation, as I have mentioned earlier, like 3 of them may not enough. We need the secondary evaluation like cost-effective evaluation or cost-benefit evaluation in terms of the health production function. This slide shows the level of disease control. The control aimed at reducing incidence or prevalence to the level at which it is no longer a public health problem. While the elimination reduced the case transmission to the predetermined every low level until there is no local transmission in a defined geographical area. But eradication is the termination of all transmission by extermination of the infectious agent through surveillance and containment. The zero case worldwide or the control measure no longer needed anymore. One of the major functions of public health system is the disease prevention. In general, preventive care refers to measures taken to prevent diseases instead of treating the symptoms. The 3 levels of preventive care are primary, secondary, and tertiary preventions. Primary prevention is to intervene before the disease appears. It aims to avoid the development of disease or disability in healthy individuals. Most population-based health promotion activities, such as encouraging less consumption of sugar to reduce caries risk, vaccination for infectious diseases. Secondary prevention aims for early disease detection, prevents the emergence of symptoms, or so-called pre-symptom phase prevention. For example, screening tests for pap smear or for cervical cancer. Tertiary prevention aims to reduce the negative impact of an already established disease by restoring function and reducing complications. The tertiary prevention also aims to improve the quality of life for the people with the disease. For instance, the treatment of diabetes retinopathy in diabetic patients, the rehabilitation after stroke. You will have to study common words related to public health in the reading source given and use them to complete the test at the end of the lecture. These links of the public health terminology from World Health Organization, CDC, are the good reading sources for you to further study after the lecture and use them as the open book sources for the final quiz and assignment. The open web links from this private sector is also attached for quick reference for your what's finding. Any question or suggestion, please do not hesitate to contact me. Thank you.